Nowadays we know, and it's accepted even by the American Medical Association, that obesity, being overweight, is a disease. It's not a problem of willpower, it's not a problem of society, it's not a problem of you can do it yourself, or don't be so weak, and it's a disease. And a disease that goes on and on and on. And just like we have surgery for gallbladder disease and colon cancer and all these other things, we have now a surgery which is the best treatment to treat the disease of obesity. Obviously, we'd like for everybody to lose weight and for everybody to keep the weight off. The nice thing about the surgeries that we do, called the gastric bypass and the sleeve gastrectomy, the nice thing about these is everybody loses weight. There's 100% guaranteed weight loss with that. And it's a lot of weight. So for example, a person who weighs 300 pounds will lose on average in the first year about 1/3. So that's about 100 pounds. And obviously a patient who weighs only 210 pounds loses about 70 pounds. So it's about a little third or a little bit less than a third on average. But everybody loses weight. That's different from most diets or exercises where people lose a few pounds at the beginning, and then it's a struggle, and then they have to fight it. And with the surgery, it's an automatic weight loss. I like doing it. I love doing it. I love taking care of the patients afterwards. It's just good to see people do well and come through this and don't have much pain and then go home the next day, and it's just a great feeling of satisfaction. But then even more so, it's afterwards when they come to the office. And I love seeing people who come back, particularly 5 or 10 years later. I tell patients that this is like a marriage. We get married. We are here for them. I hope they will come back to see us. And we do want to see them every 6 months for the rest of their lives, as long as I'm here, as long as they are coming. And it's great when they come back and they tell us stories that, I have people who run marathons, there are people who run shorter distances. I have one person who is a professional mixed martial arts fighter. We have people who tell us that they've finally traveled with their kids, they become coaches on soccer, football, baseball teams. They can buy clothes off the rack. Every day in the office when I see a person, someone tells me I gave them their life back, I'm a lifesaver, and that's just a great feeling. That just makes it all worthwhile.